Hey there, health enthusiasts! Welcome back to Eleanor's Healthy Channel. Today, we're tackling a surprising topic. When ginger, yes, the golden root that's loved for its incredible health benefits, might actually be harmful. You've probably heard how ginger can help with digestion, nausea, and even inflammation, right? But here's the catch. Not everyone benefits from ginger the same way. In fact, if you have certain health conditions, ginger could pose serious risks. So grab your tea, sit back, and let's uncover the truth about when you should think twice before adding ginger to your diet. Before we dive into the risks, let's take a moment to appreciate why ginger has been a superstar in kitchens and medicine cabinets for centuries. Here's what makes ginger so special. Nausea relief. Whether it's morning sickness, motion sickness, or even nausea after surgery, ginger can work wonders. Digestive aid. Feeling bloated after a heavy meal? Ginger speeds up digestion and reduces discomfort. Anti-inflammatory power. For those with arthritis or sore muscles, ginger can act as a natural pain reliever. Immune booster. Thanks to its antioxidant properties, ginger helps the body fight off colds and infections. But here's the twist. While these benefits are amazing, ginger isn't a one-size-fits-all solution. Let's talk about when it can actually do more harm than good. Ginger's powerful properties are exactly why it can become problematic for certain people. Let's go through the conditions where caution is key. First up, blood disorders. If you have hemophilia, a condition where the blood doesn't clot properly, or if you're on blood-thinning medications like warfarin or aspirin, ginger can be dangerous. Here's why. Ginger acts as a natural anticoagulant, which means it thins your blood. While this can be helpful for preventing clots in healthy individuals, it can lead to excessive bleeding for those with blood-related issues. For example, imagine getting a simple paper cut. For someone without these conditions, it stops bleeding in a few minutes. But for you, it could take much longer and require medical attention. The same risk applies to internal bleeding, which is far more dangerous and harder to detect. If you fall into this category, avoid ginger tea, supplements, or excessive amounts in your diet. Ginger is often recommended to pregnant women for easing morning sickness, and it does work, but there's a fine line between a safe dose and too much. Studies suggest that consuming more than 1 gram of ginger per day during pregnancy can stimulate uterine contractions. This increases the risk of preterm labor, especially if you're in your 2nd or 3rd trimester. A real-life example. Imagine a pregnant woman who drinks multiple cups of ginger tea daily to combat nausea, unaware that it's putting her and her baby at risk. If you're pregnant, it's best to stick to small amounts and always consult your doctor first. Do you have gallstones or a history of gallbladder issues? Then ginger might not be your friend. Here's the deal. Ginger stimulates bile production, which helps digest fats. For most people, this is beneficial. But if you have gallstones, the increased bile can exacerbate the problem, causing severe pain or even blockages. If you've had gallstones or gallbladder surgery, ginger could trigger uncomfortable symptoms. Be cautious and talk to your healthcare provider. Ginger has a natural ability to lower blood sugar, which is great, unless you're already taking medication for diabetes. The combination of ginger and medication can lead to hypoglycemia, a condition where your blood sugar drops too low. Symptoms include dizziness, sweating, and confusion, and in severe cases, it can lead to unconsciousness. If you have diabetes, always consult your doctor before adding ginger supplements to your routine. Ginger can lower blood pressure and improve circulation, which sounds great, right? But if you're on heart medications, this can lead to complications. For example, combining ginger with beta blockers or anticoagulants can cause irregular heart rhythms or dangerously low blood pressure. Heart health is delicate, so don't take risks. Check with your cardiologist before consuming ginger regularly. So what should you do if you're in one of these risk categories? Here are some tips. Moderation is key. Stick to small amounts of ginger. Less than 1 gram per day is a safe starting point. Opt for alternatives. If ginger isn't suitable for you, try substitutes like peppermint tea for nausea or turmeric for inflammation. Consult your doctor. If you're on medication or have a chronic condition, always discuss your diet with a healthcare professional. There you have it. While ginger is a powerful and versatile root, it's not for everyone. Remember, health is personal. What works for one person might not work for another. If you found this video helpful, please give it a thumbs up and subscribe for more health tips and insights. Don't forget to share this with friends and family. It might save someone from an unexpected health scare. Thanks for tuning in, and I'll see you in the next video. Stay safe, stay informed, and take care.